Welcome once again to the NNLM Region 4 Connections webinar, a regular discussion of issues important to medical librarianship, health literacy, and health information. The webinar is hosted by NNLM Region 4, based at the University of Utah Spencer S. Eccles Health Sciences Library. My name is George Strawley, and I am the Library Engagement Specialist for NNLM Region 4. Our speaker today is Jaena Alabi. Jaena is a research and instruction librarian at Auburn University for the areas of English, psychological sciences, and African American and Africana studies. She's also coordinator of the RBD Help Desk at Auburn's Ralph Brown Drawn Library. Before joining Auburn, she served as the English librarian at Indiana University, Purdue University in Indianapolis. In addition to her MLIS, Jaena holds a Master of Arts in English. Both degrees are from the University of Alabama. Her research focuses on the effects of racial microaggressions on the library profession. Jaena will present a brief history of racial microaggressions research. She will focus on the negative mental and physical health outcomes associated with experiencing subtle racism. Welcome, Jaena.
Thank you, George. And I think if I can share my screen now, I can pull up my slides.
Sure.
Thanks. All right, so thank you everybody for having me today. I really appreciate the chance to come and talk with you about a topic that I'm very passionate in and interested in. Thank you for the introduction, George. I do want to highlight a couple of things that I think are important, or share a couple of things that I think are important about me. And that is that I am a cisgender, white, straight, non-disabled person. So a lot of what I'm going to share with you today is actually from the research, from the literature, but there will be some times where I may share my opinion, my thoughts on something. And I think it's important for you to know that that is going to be shaped by those aspects of my identity and those various spaces where I am oftentimes privileged. So I do want to acknowledge that. I do also want to take a minute. I know we're all in different places. I am actually here in Auburn, Alabama, and that is the traditional territory of the Muskogee Creek people. So I'd like to acknowledge the legacy of the Muskogee people. And one of the things for land acknowledgements is also to sort of talk about how are you going to engage with or contribute back to this community. So after our presentation today, I am going to make a donation. It'll be kind of small, but to the Muskogee Nation Scholarship Foundation program. So that's my commitment. And I don't know about y'all, but I generally like to know where we are going in a presentation. So I think I have about 25 slides. There's a number in the bottom corner if you want to figure out where we are along the way. So what we'll start with is a definition of microaggressions, racial microaggressions, and then a select timeline of research. So that's not going to be comprehensive. It's really going to be the points that pop out to me as being important. We'll talk about the physical effects associated with racial microaggressions, as well as the psychological, emotional effects. And then apparently we're going to talk about physical effects again. I made a couple changes on this slide at the last minute, I think. And then we'll talk a good bit about some response strategies and ways to mitigate those negative effects of racial microaggressions. My favorite part of any presentation is really the Q&A session. So I'm hoping to allow a good bit of time for us to engage in some conversation there. So before we get started and really talk about racial microaggressions and the research there, we should understand what racial microaggressions are. So I'm using the definition by Su et al. From 2007. So racial microaggressions are brief, commonplace, daily, verbal, behavioral, environmental indignities, whether they are intentional or unintentional, that communicate hostile, derogatory, or negative racial slights and insults to the target person or group. So there's a lot in this definition. So I do want to unpack a couple of things here. The brief commonplace aspect. So these are things that happen all the time. So when we start looking at the effects, part of that that's going to come in is that these are things that are just sort of cumulatively building up over and over. It's also really important to note that it doesn't matter whether you intended to send a negative message to someone or not. There is still the effect of harm being inflicted on someone else. So, and in fact, a lot of racial microaggressions are delivered unintentionally, but that doesn't absolve those of us who are committing that from the harm that we're causing. And also, in these exchanges, there will be oftentimes kind of an underlying message. Some of us might call that sort of the quiet part that sometimes we have been hearing be said out loud more often, especially when we look at sort of our political ecosystem. But that underlying message is communicating something hostile, negative, derogatory. So let's take a look at a couple of examples. The Sue article that we'll talk about a little bit more sort of talks about why racial microaggressions are a problem, gives a lot of examples of racial microaggressions, but then also goes through and identifies, why is this a problem? So for example, in this particular statement, oftentimes this would be maybe you're meeting somebody for the first time, you're asking them where they're from, and they say, oh, I'm from Kansas. And you might say, no, where are you really from?
$1 billion.
How?
She owns several castles,
Oh,
and when they die, they get buried underneath the church.
so I think we have somebody unmuted.
That's where her husband is, and they're in.
Let me see if I can find that person, and I will
be
meet
going
them.
along with her.
All right, so I'll keep going. But this message of like, no, where are you really from? So you're sort of telling that person that they're not from where they say they're from, which is kind of offensive. But also the message that you are sending that you may not be aware is like, you're not American, or you're not from here, you don't belong here. If you really are trying to engage with somebody and get to know them, connect with them, basically telling them that they don't belong or they're not from where they say they're from is not a way to do that. Oh, well, I gave you the answer here. So also saying to somebody, oh, your English is so good. The underlying sort of meta communication that you're saying is like, you're a foreigner. It doesn't matter that you're born here or that you've spoken English here in the US for 30 years. There's this message of like, you always will be a foreigner. And again, like, you don't belong. Another microaggression that is sort of one of the typical ones pointed to is this kind of statement of, you're so articulate. And it's often said with kind of the sense of like awe and amazement, like, wow, you're so articulate. And typically, well, not typically, but the underlying message there is that I didn't think you were going to be articulate based on what you look like, based on your race or ethnicity. I kind of thought you weren't going to, be able to string some words together. And then another one is, when I look at you, I don't see color. I know a lot of us might think that's great. Like, isn't that what our goal? And it's really not, because race is a part of who you are. It shapes your experiences in the world. And trying to sort of say somebody, I don't see color, well, then you're saying, I don't see this whole part of you, this whole aspect that has shaped your experiences, your identity. So it's denying that person's experience and identity. And so I want to take us back a little bit into kind of a quick timeline. I know microaggressions, racial microaggressions have been mentioned in social media and other places, especially more recently. But the concept goes back to the 1970s with Chester Pierce. So he's a Harvard education and psychiatry faculty member. And he starts by talking about offensive mechanisms. So we have defensive mechanisms in psychology, psychiatry, where they help to prevent you from feeling shame and guilt. But he's looking at offensive mechanisms and how those are used to basically enforce the sort of racial superiority, these feelings of racial superiority of one group over another. And so one of the things that he says about that is that most of these offensive actions are not gross and crippling, they're subtle and stunning. The enormity of the complications they cause can be appreciated only when one considers that these subtle blows are delivered incessantly. So again, if we think back to that definition by Sue, it's that repeated, continued attack or assault on a person. And Pierce also goes on to say that even though any single negotiation of offense can be considered relatively innocuous, the cumulative effect is unimaginable magnitude. Hence, the therapist is obliged to pose the idea that offensive mechanisms are usually a microaggression, as opposed to a gross, dramatic, obvious microaggression, such as lynching. So he's kind of setting up that juxtaposition. There's also some later research that Pierce and his colleagues do in the 77, 78, where they're looking at TV commercials and they're quantifying and showing who it gets to do different things on these ads that are shown in these TV commercials. And so white men have the broadest range of activities that they can engage in. They have a lot of things that they can do for leisure, and then white women. And then there are certain ways that Black men are depicted and that Black women are depicted, and their range of activities is much more limited. So he takes this idea of racial microaggressions as it being a very subtle way to sort of tell people what their place is and what they can do. In 1989, Peggy Davis is trying to sort of respond to this National Center for State Courts survey that showed minority people reporting the conviction that the law would not work in their favor. And so she's going through and trying to explain this, like why would people think that the law is not going to work in their favor? And so she goes through and quotes Charles Lawrence in sort of talking about American racism being pervasive and also largely unconscious. And because of that, because we share all of these ideas that we're not necessarily conscious of, the attitudes, the beliefs that we have about an individual's race are just so deeply embedded that there's no way to kind of easily pull those apart. And so Davis argues that we might see the law as being a neutral thing, that it applies to everybody in the same way, right? But it doesn't apply to everybody in the same way, and they're shaped by certain people in certain ways. So that article is The Law as Microaggression. In 1998, Daniel Solorzano, education researcher, looks at the experiences of Chicano and Chicana doctoral students. And he uses a critical race theory lens. And so one of the things that he's doing here is we're moving beyond just an understanding of microaggressions as a Black-white kind of dichotomy. So we're looking at how that affects other groups, other races. And he's also kind of bringing gender into that discussion. In 2007, we have Daryl Wing Sue and his colleagues. And so they are taking this concept of racial microaggressions. They're looking at the existing literature that at the time is calling it aversive racism, or sometimes systemic racism, new racism sometimes. And they're trying to create a taxonomy. So they come up with certain forms that racial microaggressions take, as well as a number of common themes that are conveyed through racial microaggressions. So like we saw earlier, the theme that you're a foreigner, or the theme that you're a criminal because of your race. In 2011, Kevin Nadal created the racial and ethnic microaggression scale. So trying to quantify the experiences of racial microaggressions that people of color are having just in everyday life. There are a number of other tools that have been developed and were developed around the same time. So his is not the only one, but it's one of the ones that I wanted to highlight. Nadal also has done a lot more work expanding microaggressions as a concept into sexual orientation and gender identity as well. And then I think it's important to bring up Keon West in 2019, because they were looking at an early criticism of Sue's taxonomy was that this isn't really a detrimental thing that people are experiencing. And really, you know, ethnic minorities, maybe they're just like overly sensitive. So West designed some experiments that basically showed it's not that people of color are hypersensitive. It's really that these things are just happening so much to racialized minorities, ethnic minority people. And then in 2021, there's a whole special issue. And one of the articles there is Monica Williams Skinta and Martin Willett. So they are expanding the themes that Sue identified in 2007. So we've done a lot more research since then on racial microaggressions, a lot more qualitative and quantitative research. So they expanded the themes that Sue had previously put forward, and they kind of refined them and tweaked them a little bit. So in preparing for this presentation, I mean, I generally have sort of summarized the effects of racial microaggressions using a couple of earlier articles. But in this case, I went back and I tried to pull, I think one of these, I think Spanierman was maybe a scoping review. So started looking at their summary of the research that we've had since, you know, the 2007, 2010, around there, that have shown not just we think that there's a connection between experiencing microaggressions and things like stress or anxiety, but articles that have really kind of done a deeper dive and tried to give us more evidence that, yeah, we thought there was a connection there. There's definitely a connection there. So a lot of these citations that you see on this slide are actually coming from Spanierman. There's also a really good lit review that I saw in Torres Harding. So some of them are cited from that article. But this persistent sort of being bombarded with messages that are telling you you're not good enough, you don't belong, can lead to low self-esteem. It creates stress. And in some of the researchers actually identified it as post-traumatic stress, traumatic stress, also anxiety, depression, suicidal ideation in some of the examples, and then just kind of psychological distress in general, and overall poor mental health or poor levels of psychological well-being. So these, you know, these are not things that we want to have happen. Some of the additional research that's looking at not only psychologically, emotionally, how does this affect you, but our physical effects. So some researchers were looking at kind of general somatic symptoms. Hun was looking at headaches and stomach aches. A 2013 article with Ong sort of mentioned specifically backaches and nausea. A more recent article talked more about sleep disturbances, like insomnia. And then Ziders was looking at adolescents and actually measuring cortisol and cortisol levels, and identified that the adolescents who were experiencing more racial microaggressions had increased cortisol levels, and kind of some of the implications for that in terms of their development. Hall and Fields looking at insomnia, hypertension. And then there are some researchers too who have shown a connection between experiencing racial microaggressions and discrimination and an increased risk of substance use or substance abuse. So Zapolsky, sort of general substance abuse, Some of other researchers have looked specifically at alcohol use and binge drinking, as well as tobacco use. The Liu and Quezada article, I think, mentioned that there's some sort of externalizing using tobacco, things like that, but a lot of the consequences tend to be more of the internalizing and going back to those psychological, emotional effects. And I didn't include the citations on here, but some of the other articles that I kind of skimmed through indicated that, for example, Black women who are pregnant might be less likely to seek prenatal care because there's kind of this fear, or because of previous experiences with racism and interacting with doctors and the medical field. So we can have a lot of larger consequences for our health, not just experiencing microaggressions physically harms us in this moment, but it also can shape whether we seek help later on. There was also another article with Native American patients and their outcomes with, I think, diabetes. And there was one other thing, also not very good because of experiencing microaggressions and discrimination in the healthcare system. So now that we've talked about the negative effects, hopefully you also, like me, would like to figure out ways to not engage in microaggressions, or to help people who are affected by racial microaggressions. So we have several different kind of frameworks or strategies that I wanted to introduce you to and kind of go through. One of the first things I want to share is Thurber and D'Angelo have these sort of guiding principles for intervening in racial microaggressions. And so they look at that if you are the observer, if you are the perpetrator, and if you're the target of a microaggression. And so one of the things in terms of guiding principles as the observer, they want you to think about, not saying just the right thing and what you're going to achieve by doing that, but what will you lose if you don't speak up? So for example, will our colleagues who maybe are the target of a microaggression think that we condone the message that's being sent to them, or that we support the perpetrator and their view on this? Because that's something that we probably want to avoid, right? So that gives us, I think, a reason, not just a reason, but it helps us have a little bit more courage, I think, about speaking up. And then also asking ourselves, what do I want to accomplish? What's my goal? So do I want to educate the perpetrator? Do I want to sort of show somebody else that I'm trying to behave as an ally? I'm trying to be supportive and create the environment that we want us to have in our workplace or wherever we might be? Or are we trying to raise consciousness and like, hey, I don't know if you were aware, but this is the thing that maybe we should not do. And then they also really encourage people to, when they are an observer and they're trying to intervene with a microaggression, to speak up, but also ground our actions in care. So it's not so much kind of a calling out, but more of a calling in. So you're kind of issuing an invitation to the perpetrator to reflect upon their own actions and the effect that those actions have had, more so than saying, hey, you were a jerk, don't do that, right? You're inviting somebody to reflect on their own behavior. And then for perpetrators, sort of being open and receptive to feedback. One of the things that I like to think about is if I'm walking around with broccoli in my teeth or with my zipper down and somebody stops me and says, hey, you got broccoli in your teeth, or hey, you should zip up your pants. In general, I am likely to respond to that with, oh, thank you so much. Let me go fix this so that I look the way that I would like to look, right? And so trying to carry that same spirit forward. I know that when we talk about racism and oppression, that is a very sensitive subject, and especially when a lot of us think of ourselves as good, moral, decent people, that can be an attack to our sense of self. But I try to think about it in terms of this person has given me some of their time, and they've told me this thing that I now know has happened, or that I now know I've done that I didn't mean to. And I can work on that. I can fix that. I can make that better. I can not do it again. So again, kind of focusing also on impact, not the intent. So many times when somebody has sort of said, hey, did you know that this happened? Or this is the message that you were sending that I don't think you meant to send. The perpetrator can often say like, oh no, I definitely didn't mean that. And it's not enough to just say I didn't mean that. We also need to try and work to correct the harm that we have done, that even though we didn't mean to. It's just like if I step on your toe when I walk by you, I'm going to apologize and then try to make it right. I'm not going to say, oh, I didn't mean to step on your foot, and just keep going. They also encourage perpetrators to seek restorative action. So in this case, the purpose here is not to sort of issue an apology and be forgiven. It's really acknowledging the conduct that you have participated in, articulating a plan to change that behavior, inviting the person that you have affected to say whatever they might feel needs to be said, and then kind of asking if there's anything else that you can do to sort of move forward with that person. So the purpose here, again, it's not just sort of seeking forgiveness. It's really about ameliorating the oppression that you have participated in and trying to understand the consequences of your actions and also make change for the future. And then for somebody who is the target of a microaggression, their first responsibility is really to themselves. And Thurber and D'Angelo encourage targets of microaggressions to take time to recenter. So not just immediately say, oh no, I didn't perceive that correctly. I'm just gonna move on, but really take time to, well, how am I feeling about this? Recenter, and then also asking yourself, what do you want to have happen here? And then reclaiming your voice if you want to. Although they do really emphasize that if you're the target of a microaggression and you're just like, I don't have the bandwidth, I don't have the capacity, I don't want to engage with this person, I don't want to educate them. You don't have to. That is not your responsibility. Your first responsibility is to take care of yourself. And so I think it's really important for those of us who are less likely to be targets of racial microaggressions to think about that, and especially our role as observers, because oftentimes if you are the observer and not a target, you have a little bit more space where you can engage with the perpetrator and maybe talk about that without having to be the person who's always having to be the educator for everybody in this situation, if that makes sense. So Sue and some of his other colleagues more recently came up with micro-interventions as a response for dealing with microaggressions. And in their definition, these are similar to microaggressions. They're everyday words or actions, whether intentional or unintentional. But these communicate messages to the targets of microaggressions that their experiences are valid, they're valued as a person, it affirms their racial or group identity, offers support and encouragement, and reassures that person that they are not alone. And so these micro-interventions have some strategic goals. And so that is making the invisible visible, disarming the microaggression, educating the offender, and seeking external intervention or support. So some of the ways that you can make the invisible visible is to sort of undermine that meta communication, undermine that message that's being sent. So you can do that by naming it, or also making the meta communication explicit. So, you can ask questions. You can say, are you aware that, when you said this, it implied that this person isn't from Kansas, or whatever the situation might be. You can also challenge the stereotype that's being communicated, ask for clarification, and broadening whatever trait has been ascribed to kind of a universal human behavior. So one of the themes of racial microaggressions is the assumption of criminality, the assumption that people of a certain race are going to commit crimes. So one thing that you could say in that situation is, well, robberies and crimes are committed by people of all races and backgrounds. So kind of directly challenging that assumption. You can also disarm the microaggression, so expressing disagreement. So even just saying, oh, I don't think so, I don't agree with you on that. You can state values and set limits. So for example, I think Sue gave the example of saying something like, you know that respect and tolerance are important values in my life. And while I understand that you can say whatever you want to say, I'm asking you to show some more respect in this situation and not make these offensive comments. So that's definitely, at least for me, that is not a way that I am used to engaging with people, but I definitely see the value in that, and it requires practice. And then describing, some of it is really just describing what's happening. One of the examples that Sue uses for using an exclamation is just, ouch, like that stereotype hurts. Even using nonverbal communication, so furrowing your brow, shaking your head, or you can interrupt and just redirect the conversation elsewhere. And then educate the offender. So pointing out that, this thing that they've done or that they're assuming is connected with people from a particular group actually isn't. Maybe we both have this thing in common that we want to focus on. You can appeal to the offender's values and principles. So for instance, I know that you value this or that, and the message that you've just conveyed runs counter to that. Also trying to differentiate again between intent versus impact, trying to promote empathy. So the idea of, kind of calling in versus calling out, and then pointing out how they benefit. So the example he gave is, I know you're studying clinical psychology. Learning about why those stereotypes are harmful is going to make you a better clinician, right? So why will they benefit from being educated about this and changing their behavior? And then the last one is seeking external support and intervention. So that could include alerting authorities, reporting the act, so calling HR if this is something that's happening in the workplace, but also sort of self-care. So seeking therapy or counseling, seeking support through whatever works for you, whether that's your community, some spiritual activity, a religious community, setting up a buddy system. A friend of mine calls that her am I tripping buddy. So you call them, you tell them this thing happened, and then they can provide that, oftentimes that validation for you and that other outside perspective. And then also attending support groups can help as well. And so those are some guidelines. We'll see a lot of commonalities as we go through a couple of these acronyms that I wanted to highlight. There are a lot of people, a lot of organizations, a lot of groups that have created training, workshops, professional development seminars, and everybody seems to have their own acronym for how to deal with racial microaggressions. So I wanted to go through just a couple. This is Open the Front Door, which is Carrie Ann Rockmore shared this in a blog post on Inside Higher Ed. And so that is where you observe. So you clearly describe what you have seen happen. You make a statement about what you think about it. You state how that makes you feel, and then you state your desired outcome, what you want to see happen. So in the example that Rockmore was using, she was a member of an executive club, and there were no other women at this particular meeting. So one of the men said, oh, maybe next time we should have a meeting at the mall and focus on shopping to get more women involved in this group. And so according to Rockmore, an open the front door approach to that would be a statement sort of like, when your response to the fact that this group is almost entirely male is to suggest that we meet at the mall, the observation, it sounds like you think female leaders are primarily concerned with shopping, and that's insulting to them and their accomplishments. That's what I think. I feel embarrassed and uncomfortable. That's what I feel. And I would like us to take the concern seriously and discuss why women have stopped attending our events. That's the desire, what you want to see happen. Soto Santiago, Mack, Duncan, and Smith created a professional development program about responding to racism and discrimination. And they have kind of adapted this open the front door method. So again, you're observing, clearly stating what you saw happen. But then there's this kind of this step before we get to the front door. And that is asking, like, what did you mean or why? And then you state what you think about it, how you feel about it, your desired outcome. So their example is, maybe you're in a meeting and a lot of people are interrupting. So you might say, I noticed, I observed that some people are interrupting others while they're speaking. What do you mean? Or why are you doing this? And you have to pause. And you have to stop. You have to listen to their answer for this. And then you can say, I think that we need to actively listen to all of our ideas so we can learn from each other, maintain norms of respect at our meeting. I feel uncomfortable moving forward without making a change to how we're operating. Can we please speak one at a time so we can give others the chance to share? So very similar to Rockmore, but adding in that kind of pause and that asking, what's happening here? What are you doing? What did you mean? In another workshop, this is Nafisa Warner, Catherine Jossie Ori, and Erin O'Brien. They have come up with grit. So you start by gathering your thoughts. So you pause. You don't just have an immediate knee-jerk reaction. Try not to react with anger. And basically decide, is this the right time? Or should I have this conversation with this person somewhere else in a different environment? And then you restate the comment that person has made. Or you ask them to restate. What did you just say? Or could you tell me what you said again? So that kind of gives the person an opportunity to be like, what did I just say? Ooh, those words were not what I meant to come out of my mouth. Or maybe not. Sometimes we don't always catch ourselves in the moment. So you can ask that person to clarify what they've said, clarify what they meant. So hopefully they can realize for themselves what has happened here. You can inquire, so asking questions, digging deeper. So like, can you help me understand what you meant by that comment? So it's important though to be non-judgmental, to really address the comment or the action and not sort of the person. So it's not about the person. We're trying to separate that and make some distance there. And then finally, sort of talk it out. So discuss the potential impact on others, discuss your perception of what was said or what the action was. So they also emphasize that if you are witnessing a microaggression, that when you are intervening, when you're kind of jumping into this, to speak for yourself and your perception of this event. So it makes me uncomfortable that this has happened, or I feel like this is setting a tone for our meeting that I don't like. I feel like it's not setting the tone that we would like to have. So you're focusing on you and not the person who is the target. Like, don't speak for that person. All right, and then Walker, Hodges, Perkins, Sim, and Harris adapted Soto Santiago's Open the Front Door with the W into the Vitals tool. And so for that, step one is always to validate what you're feeling. One of the things that a lot of people who are experiencing racial microaggressions will sort of talk about is like just a feeling of general unease after the microaggression has occurred. Like, that didn't leave me feeling good, but I can't quite put my finger on it. Like, is this what I thought it was? So validating your feelings, always starting there. Like, you feel something has happened, don't try to talk yourself out of it. And then again, inquiring, so asking for more information, trying to get the person to elaborate, and then taking time to reflect what that person has said. So for example, so I hear that you're saying this. Is that right? Do I understand what you're saying? And also even taking the time to say, it looks like you're frustrated, or it looks like you're angry, or whatever the emotion might be, trying to identify that. And then assuming the best of each other, so the best of intentions, but also the need for clarity. So keeping in mind that that difference between intent versus impact, and trying to make sure that you are letting that person know, like, I don't think that you intended it this way, but here is the effect. Again, trying to separate the person from the action or from the word. And then leaving opportunities for follow-up conversation. In their training, they said, this is not a sitcom. We can't necessarily wrap everything up in one conversation or in 30 minutes. So leaving the door open for more conversations, more discussion about this. And then speaking up, so being direct in naming the microaggression and asking for some action to be taken. So even saying something like, I don't think that's appropriate, or that's not how we treat each other. So again, I think really highlighting the role of the bystander and being able to have sort of the space, the capacity to say, I didn't like this, and let's figure out how we can do something different, how we can be better. So just some final thoughts about responding to microaggressions. I'm one of the people who freezes all the time. So I know that responding can be really difficult in that moment. If you're the target of a microaggression, it also takes a lot of time, space, energy to process that. And I just want to highlight that, there's no one perfect response. It would be great if there was just one statement that we could just put out there and that solved microaggression every time. But that's not how things work. Context is going to be important. Context is always going to dictate what will work, what won't work. In a situation, relationships between people involved, power dynamics will also affect how you respond. And the other thing I wanted to say is that you are going to mess up. You're going to do it wrong. But I feel like we can't just let that fear of being wrong and not being perfect keep us from doing something that I hope will help us to get better. So this is just like, you don't get better at baseball by not throwing the baseball, right? If you're bad at it, you have to work. You have to try and get better. Especially because I think a lot of us do have values where we want to include others in our conversations, in our work, and have good relationships with people. So in order to do that, we've got to engage in this work, and we will mess up, and we got to work on how do we recover from that? How do we learn? How do we go forward? How do we do better? All right, so I would love for us to have some discussion. If you have questions, I try to come up with some answers. And I will also just sort of say that I have already posted these slides to my institutional repository. So if you want to see the references, those are going to be at the end of the slide deck. I know librarians enjoy references.
Thank you very much for your presentation, Jaena. That was really valuable, and I appreciate it, and I know everybody else does too. So yes, we do have some questions and comments, and forgive me while I scroll through this for a moment and get to them here. For one thing, Michelle mentions that there is at countway.harvard.edu, there is an opportunity to learn more about Dr. Pierce and his work. It's the Center for History of Medicine that has digitized a lot of his work. So there is a finding aid there. And a question from Elaine, in the court system, when are BIPOC individuals ever judged by a jury of their peers? So where is the equity in that? I think it's more a comment, but if you've got any thoughts on that at all.
No, I think that's a great comment, a great point. And especially, I think if you look at this from the late 80s, I would imagine that the makeup of juries was even less diverse than it might be now. And if you look further back in the legal system, you find it even worse. So yeah, I think that's a good point.
Great. And we also have a comment here. Calling it is a great point that I have never heard of before. Calling in is a great point that I've never heard of before. Most people as observers will call out perpetrators and nothing gets amended.
Yeah, I think when we call somebody out, oftentimes we're trying to guilt them or shame them. Those tend to not be very productive emotional responses. But that sort of calling in of being like, maybe you can reflect, like, let's reflect on this. I also have some colleagues that I've seen who have been really good role models for not necessarily calling in, but they've been good role models that I think have helped me to reflect on my own word choice, for example, or how do I respond when I have messed up? So I have seen colleagues who they'll say something in a big group presentation, and then we have kind of moved on, and then they'll be like, wait a second, I just want to come back to this thing that I just said. I didn't mean it this way. Like, I feel like there could have been a message that was sent here that I didn't intend. So if I could redo the last 5 minutes, I would say this thing instead. And then we move on. So we're not sort of dwelling on it. We're not going to talk about it for the next hour. It's just a really quick, I didn't say what I meant to say there. Let me rephrase. Let's move on. And I'm sorry, I feel like maybe, George, was there more to that I cut you off on?
Oh, well, I was just going to add, there was another comment here from Danielle. She mentions that she thinks that calling in only works with perpetrators who don't have the intent to purposely make the microaggressions. Those who intentionally say or do these things to people usually aren't trying to amend their behaviors. They usually just walk it back at that time because they've been called out on it. I think you kind of alluded to that a little bit, I think.
Yeah, I mean, I think it can be tricky because we want things to change, and there are some people who I think have good intentions, and yes, we can draw them in, and maybe we can have that positive change. And then there are some people who do not want to change, and they are the way that they want to be. But I think we can still work with the larger group of people that we're with usually to sort of say, like, these are going to be the standards of how we interact with each other. And so if you're going to be over here and be actively trying to denigrate somebody, you're going to be excluded a bit for that behavior, because what we value is interacting in this particular way. And I actually don't know if that makes sense as a response to that question comment, but that's where my mind went.
I think it does. I think it does. Whitney says the impact versus intent part of it is the hardest to get through to someone in her experience.
Definitely agree. I saw a training one time where the facilitator basically set up that example of, okay, so we have 10 people in the room. And so this person, John, if I walk by and I step on John's foot, he's gonna be like, oh, that hurt. Okay. And then if you walk by and you step on John's foot, and then everybody in the room, as we're leaving, if we all step on John's foot as we leave, at some point, like that last person, John might kind of snap and be like, would you stop stepping on my foot? And experiencing racial microaggressions can be a lot like that. The point at which you might see somebody say something or respond in a way that you feel is an overreaction is because you have not experienced that cumulative effect of this sort of compounding again and again and again for this person. And also, it's not like any of us intended to step on John's foot, right? We just happened to walk past him and whoops, it was an accident. I don't know if that is helpful to try and convey that to people. It really made sense to me.
Yes, it does. And I'll throw in a question that I personally have, which was how do you deal with the person who says, or if you say, look, you just stepped on John's foot, and that person criticizes you for for pointing it out, or might put it in, especially if you, my big fear is people will put it into political terms. You're just an overly sensitive liberal who doesn't get what's going on and can't take a joke or something like that. Do you have any thoughts about that?
Some of my thoughts are really focused on my personal experiences, right? Being a woman from the South, where I think in a lot of ways we are socialized to try and make nice and keep everything kind of comfortable, sort of, for most people, except for the people who are being oppressed or whose feet are being stepped on. And so one of the things that I feel like I've had to learn for myself is trying to sort of push back on that and be like, okay, so what happens if I do speak up here? It might make somebody uncomfortable, but does that actually help me to enact my values and the things that I think are important? So if I think that it's important for us to treat each other with respect and to not convey denigrating messages to each other, then I should say something. And then maybe there will be an effect that somebody calls me a snowflake or whatever they want to call me. When it comes down to it, does it hurt me to be called that? There's really no real effect on my life from that. Whereas our American insistence on ignoring racism and not talking about it, not addressing it, has detrimental effects to the lives, the livelihood of lots of people in this country. So, okay, I don't mean to be flip in that response, but that's how I kind of have tried to work through that. I mean, I understand the hesitation of like, well, but if I say something, then I'm going to be seen this way. Well, I mean, what do I value? Mm-hmm. And do I need to say something in order to not implicitly consent to this thing that's happening that I don't like?
Good point. Very, very good point. I'm going to jump to some other questions. There's a whole bunch of them. And if we don't get to the question, I'll try to save them so they can be addressed. How would one address an ally that thinks they are helping by calling out perpetrators when it just leads to a shaming argument?
That is a good question. I don't have all of the answers. I might be inclined to try to talk to that person and sort of maybe even just a conversation about, the ways that we try to get people to change their behavior. Oftentimes, if we start with like, oh, smoking is bad, smoking is dirty, smoking is immoral, you shouldn't smoke. Well, there's a whole industry of people who still smoke, right? But not, well, there's the whole industry and there's people. So there are reasons. Let's try to address some of the things that might be keeping these people engaging in certain behaviors that we don't want to see. So also, I think trying to, again, invite that person to reflect on their behavior. And it's like, okay, so if you are always jumping in, calling out somebody on a racial microaggression all the time, well, one effect of that might be that every time you speak, people just sort of turn off and they're not listening to you anymore. So if you want to be heard, if you want it to have an effect, maybe we can sort of highlight some ways that maybe we address it in this case, or when it reaches a certain level, maybe, and maybe not every single time. I don't know if that's super helpful, but those are some initial thoughts.
Yeah, it is. Monica asks, how do we have a conversation about this if the interaction is brief? I'm thinking in terms of conferences when one is greeting a speaker or being introduced to someone else.
Can you give me sort of an example of what might what might happen in that situation?
Hi, yes, this is me. So I was at the ULA conference earlier this year. It was slightly a different a different thing, but there was a BIPOC session, and there was a man there who professed to be an ally because it was just for BIPOC members only, the session. And so we had our presenter, say, sir, please, like, this is just for them. Can we have you leave? And that was the interaction. But I thought, what happens if I'm speaking to someone or being introduced and they throw out, oh, you look so professionally dressed, or your English is so good. I've had that many a time. And I just think to myself, yeah, I was born and raised here. But in those cases, is it easier to not say I don't know, because it's like, what if you're holding up the line? Should I just like hold it up and say, no, excuse me, let's take a couple more minutes, or I know you're rushing off to another presentation, but I'm going to make you be late just because I want to let you know how this made me feel. I guess, when do you know when to have a conversation or just let it slide?
That is a great question. And I would say that there is no hard and fast rule. It's going to be up to you in that moment to how you feel about that situation, the power dynamics between you and the other person involved. Did you have a good sleep the night before? Or do you have to go to the bathroom? Like, it's all dependent on that context. But I would say, there's also, it doesn't have to just be like letting it slide. It could be even just like the response that you had there with like, well, I hope that I would speak good English. I've been speaking it for 25 years. I don't know how old you are, but whatever, however long you've been speaking it.
Right.
Or even something like, well, oh, was I not supposed to dress professionally? I thought this was a professional event. Sometimes you can just have like a little thing that's like, that's an interesting comment that you just made. Maybe they're not going to reflect on it at that moment, but I think it can still help you to feel better about that interaction with like, well, I didn't just let it slide.
Okay.
Because that is sometimes what some of the research shows, is that if you're the target of a microaggression, and if you don't say something, sometimes you can feel guilt and shame afterwards for not having addressed it. And that's where, again, like, your first responsibility is to yourself, taking care of yourself. And so finding a way to not hold on to that guilt, if you do have that as a feeling from that experience. So those are some of the things. And from the citations, if you want to take a look at that 2019 Stu article with the micro validations.
Okay, yeah.
He has several examples of like, oh, in this, here's a phrase that you could use. Here's a really quick, like, toss this out there and then move on.
Okay, that sounds good.
Yeah.
Thank you.
Well, I wish we had more time because we have a lot more questions, and I will try to save them when we figure out a way of maybe trying to get answers to people, if you'd be willing to do that. But bear with me one second.
Absolutely. And while you are doing something, I will just say, I've put my email in the chat on the slides. I also have my email there. I definitely love talking about this topic. I think it's something that we need to stop ignoring and we need to start addressing. So I'm always happy to answer whatever questions I can, and to engage in sort of further discussion, conversation about this. So if you have anything that you want to talk about, please do feel free to email me or send me a note.
Okay, well, thank you, Jaena, for a very illuminating presentation. Please join us for our next R4 Connections webinar, which is on November 10th. The topic is still to be determined, but we will get an announcement out to you on our Region 4 news blog and various librarian email lists. And by the way, you can join our list by going to tinyurl.com/NNLM-listserv. And Sam will put the link in the chat for you. Remember that NNLM's 7 regional medical libraries are available to support you with engagement opportunities, training, and funding in support of NNLM's mission to advance the progress of medicine and improve the public health. We do so by providing health professionals with equal access to biomedical information and by improving the public's access to information to enable them to make informed decisions about their health. We have a newly revised free course that we're offering titled Introduction to Health Reference, Ethics and Best Practices. Learn how to conduct a health reference interview using ethical and effective communication strategies in this 4-credit-hour online course that you can take at your own pace. Please visit our website at nnlm.gov/training for more information on this or our many other free courses. And thank you once again to our speaker, Jaena Alabi of Auburn University. We really appreciate your insight into this important topic. I think it's one that we can discuss for a long time, and hopefully everybody feels better about taking action on the topic too. And thanks to you, our audience, for being part of the R4 Connections webinar. We'll see you in November. Thank you very much.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.